Welcome to a Friday edition of Conversations with Al McFarlane. We're continuing our discussion with people in the health field and community fields, talking about the impact of COVID-19 on our community, solutions that we bring, fears that we have, resilience that we exhibit to demonstrate our capacity to do right, be right, survive, and to win, to come through the other end of this experience stronger, better. But going through it is not a joke. This is serious. And our job here at Insight News is to have experts in community reflect on, to share, to educate each of us about the seriousness that we are facing with the coronavirus pandemic. I'm pleased to have just a number of wonderful guests on the program today. We call this series Serving the Underserved. We're doing this every Friday, and we want you to join us on Fridays. We're presenting this live to YouTube and live to Facebook. So if you're joining us by Facebook, start a watch party and tell your friends that we're having this important conversation. If you're on YouTube, register, or what do you call it, subscribe to us on YouTube. We're learning the technology as we go, and so we're glad that it exists. I want to begin by asking one of my guests to talk about and give her impressions about the medical aspects of the issue of our community addressing COVID-19. Dr. Melanie Brown is here. Dr. Brown, good afternoon, first of all, and thank you for being here. Thank you for your service as a physician and as a leader, as an educator.
Well, thank you for having me. Thank you so much. So as you mentioned, my name is Melanie Brown, and I am a pediatrician. I'm at Children's Minnesota, and I also do some work with the American Academy of Pediatrics. And, this has been a challenging time for all of us, but it's just wonderful to see how so many people have really stepped up to the plate in this very difficult time. I think one of the first things that I want to talk about, and I had this on earlier, and so I will show you, is that how important it is to mask up and make sure that you're protecting others and also protecting yourself. So when I think about some of the really important messages and things that I want people to think about is how we really do have some control in our lives in a time when we can feel like we don't have a lot of control, to keep ourselves safe and our families safe and to be healthy and happy. And so we talk a lot about washing hands and social distancing, which I actually like to call physical distancing, because I think at this time it is really important that we stay socially connected. But wearing your mask is a really important part of that. Another piece within what's going on today with COVID is that, I think that, sometimes people are a little bit afraid of going to the hospitals, and they're a little bit afraid of going to the doctor's offices. And in pediatrics, we really want to make sure that children are still getting that important care that they need, that they're still getting their vaccinations, that they're still getting their well child care. So thinking about some of those issues and how can we continue to have people get the care that they need are some of the important things that are on my mind as a physician during this time.
Let me say the background to these conversations is that I was working with Dr. Inel Rosario, and she suggested that Al, Insight News with your social media platform should convene a regular session, and she'd be willing to help me connect with people in community who are passionate, who are concerned about our health, and to have these conversations. So I want to express my gratitude and my thanks to Dr. Rosario and all of the colleagues that she has called upon to be part of these conversations. And they've been truly rich conversations, fruitful, beneficial, informative, and they create for us as a newspaper content that we think is valuable to share with our audiences, our readers at Insight News, and our viewers on Facebook and YouTube and other social media platforms. One of my long-term friends and a person that I've admired for a long time is Judge Tanya Bransford. Tanya, how are you? Good afternoon.
Good afternoon, Al. How are you doing?
I'm doing well. And so you've been associated with families and juvenile justice and beyond for the longest time. So it's a wonderful pivot to talk about how the challenge is showing up in your world. as a lawyer and a judge, but also you are so involved in community, your leadership in other places with the links, for example. So talk about just your impressions, what you want people to think about as we all face COVID-19.
Well, I think it's really important as we all face COVID-19 that we follow the instructions of the medical experts. I think it's really important that we not let COVID-19 and our response to that become politicized. And so in order to keep us all safe, as Dr. Melanie Brown said, when I go into court, I have my mask on too. So I have different masks for different things. And because of course, the courts are all about access to the public, right? And we have still been open for business. We've still been open for business. We've had limited hearings that we've done while the shelter in place governor's restriction was in place in order to keep us all safe, but we still had to handle in custody cases. There are certain cases that we still had to do. So we open up for business on Monday. As we open up for business, this is going to be a slow rollout, but we have a concern about keeping all of the people that come into our courts, as well as all the people that work within the courts safe. So we are encouraging everyone, as you come into the courthouses, to wear masks, to keep social distancing. We have things marked in the courtrooms showing 6 feet apart. And in fact, some of the courtrooms are rather small. For instance, in juvenile court, that's because the history is that we usually keep them private and confidential. But if we have to have a big trial with many witnesses and with many litigants, many lawyers involved, we'll be going to the government center and having those so that there can be enough space between. The other thing that the courts have been doing in response is that we've been having some hearings conducted remotely. So to the extent possible, just like we're using this technology, we've been using Zoom and phone and other kinds of technology so that we don't have to have everyone present in the courtroom, so we can keep that physical distancing. So that's something. But I wanted to talk also, it's my privilege to be the president of the local chapter of the Minneapolis-St. Paul chapter of the Links Incorporated. And we are an international organization of professional Black women. And it's our goal to really enrich and encourage the African-American community in as many ways possible. One of our focuses includes health and human services. And in that capacity, we are so fortunate in our local chapter to have 2 medical professionals that are doctors that are active in our health and human services facets. And one of them is Dr. Melanie Brown, with whom you just heard. And we also, our chair of the Health and Human Services is Dr. Allison Brotherson. As our focus, we work also with services to youth. So we've been trying to encourage young people to go into medical fields and things like that. But really in our response to COVID, we know that this is affecting people all over. It's affecting them economically, et cetera. So there's different things that we like to do to respond. One of them is that we're going to be helping on Friday, next Friday, May 22nd, over at the St. Paul YWCA. There'll be a build a backpack or pack the purses. We'll be bringing items over to the St. Paul YWCA, and that's going to be between 1 and 3, to assist with their homeless. They have housing for people who were recently homeless, and we're going to provide resources towards those people. The idea started as pack a purse, and they said, we're not really concerned about cosmetics. We really need the nuts and bolts things that you need for a household to get going. So that's one of the things that we're going to be providing.
Great. Dr. Brotherson.
Hi.
How are you?
Wonderful. Thanks for having me. Let me just say what a pleasure it is to finally put a face to the name, Mr. McFarlane.
I'm loving the accent. Thank you for being here. Right.
Thank you. So thanks to I'm sorry?
No, I was going to introduce you more, but I'll let you introduce yourself. Dr. Allison Brotherson is with Hennepin County. And let me have you introduce yourself, talk about your responsibilities at Hennepin County. Hennepin County is a phenomenal organization, a phenomenal medical resource for our community. I've had colleagues of yours on these calls before, and each time I come away with deeper and broader appreciation and expanded awareness of the value that you and your colleagues are providing to our community. So I want to thank you in advance for what you're doing, but have you talk about your work as a physician in Hennepin County.
Thank you. So I am Allison Brotherson. I am a family doctor by profession, and have a clinic in South Minneapolis at Whittier Clinic. I am now the Senior Medical Director for the Community Care Ring Clinics of Hennepin, of which there are about 7 of them. And they're spread out all across the metro area. And we have clinics as far north as Brooklyn Park, and then we are south as far as Richfield, and then we have a couple others scattered around the area. And I have the pleasure of being the administrative and operational part of the team that does the operational administrative lead for them. I have worked at Hennepin for 15 years, and it has been one of the most amazing experiences of my life. One of the joys of working at Hennepin, being a safety net, I'm so glad you said it, so you opened the door, so I'm walking right through it, is that, as you know, it's safety net. And one of the joys that I have is that people here work here because of the mission. And part of our interest is providing excellent care to whoever walks through our doors, with a particular eye to serving our safety net and our underserved patient populations. So part of my work here as in the community clinics with COVID, the slant for me has been looking at how we serve our underserved patients, with the eye for how are we making testing available. We know that is a problem. We have had very initially it was hard to get tested. How do we make that available, particularly to patients who might not, because of their job situation, are underinsured or don't have insurance to get that done. And then the testing sites were kind of restricted. So taking them out into the communities where patients are has been a particular importance to us. But then also thinking about those people that need care that are not coming in, how do we proactively reach out to them and get them in? We've even thinking of taking testing out. So those have been the main areas in which I have worked. Even though I do see patients for the last 2 months, have been working more in my administrative role. So even though I have not had to haven't had that much contact clinically, certainly have been thinking about how we, as part of the team that's doing this, how are we providing care to our patients. One project that we're working on right now is how do we set up, after you get your diagnosis of COVID, we can't hospitalize everyone, but what do we do? What kind of community resource do we put out there? What sort of home monitoring can we put in place so that we could reach out to patients who are positive and provide home care by telephone or by video and make sure they're doing okay? So when they start to decompensate, we can bring them back in quickly. One of the things that we know about COVID is that you could be asymptomatic or you can look fine when after you get your test, but by day 8 to 10, people just can get really sick very quickly. So we want to catch that window and be proactive and reach out and get them in. So that's that's the program that we're working on right now, trying to get that up so that we could provide support to patients. Part of the thing, one of the things that we have are very interested in with the links, and of course at Hennepin, is that a lot of the African American population, which is a particular interest to us, lots of underserved patient populations are really having a lot of difficulty and have poor outcomes with COVID. But in the African American community, we know that we have a higher burden of disease, obesity, hypertension, heart disease, renal disease. And so the burden and the risk to them from COVID is high. And so that's why it's so important for us to make sure that we put our arms around those patients and make sure that we are proactively reaching out and getting them in before they become ill. So that's one of the joys, I think, and of working at Hennepin. I could tell you lots and lots of things that we've done. It makes me feel really proud to be part of this organization, because the thinking that goes in, it's always patient-centered, always thinking of the patients that we take care of and how can we provide the best care, even though they're not in our doors. How do we get out and take care of them? So that's my take and my end of look at the world from how we're looking at COVID.
I'm going to come back to you with more questions in a few minutes.
Sure.
Hennepin County is the most impacted county in the state of Minnesota. So I'm going to ask you to address that. And I've been looking for information from the county. You might or might not have it on the demographics in Hennepin County. What is the racial profile of the people that have been affected and people that have died in our county? It's a concern of mine. It's information that I think should be public. But let me bring in one more voice to the conversation, and that is Connie Sheehan. Connie, how are you? And thank you for being here.
Oh, I'm doing well. Thank you so much for having me on. I'm honored. Thank you. I appreciate it.
And I'm going to simply introduce you as the owner of Push Fitness and let you go from there.
Okay, great. Thanks. So, yep, I own a fitness studio in St. Paul, and my focus on my mission is to go after women of color. I'm primarily trying to make sure that my sisters are making sure that we are taking good care of our bodies. And so I'm going to just echo what Judge Bransford said, is that I always say, first, always check with your doctor. And the medical part of it is the most important as we deal with COVID-19, right? So to wear your mask just to be safe. But I think everybody would agree that if we were all moving our bodies and being more healthy, then we would be in a better position to fight all of these diseases that we just talked about, high blood pressure and renal failure and diabetes, all these things. If we are taking good care of our bodies in the first place, then it just follows. It will be in a more healthy position to be able to fight this. And so, so my mission has been just to get people to move. And it's not to come to Push. It'd be awesome if you could come. And I'm not even doing classes at my studio. We're doing all Zoom classes. But to do anything, get outside, walk around for 10 minutes. It is gorgeous today, right? So anything that we can do to continue to move our body, we are going to be healthier because of it, and then in a better position to fight this disease. So I have just been harping on this lately to all my folks, saying, you got to move. You have to move your bodies. It is really critical right now. So I'm doing lots of classes right now on Zoom. All of my classes are on Zoom right now, and it's working pretty well. People show up. Some of my clients are actually in their backyards working out with me. So you don't need equipment. You can just come, and there's so many free classes now. I mean, people say to me, gosh, Connie, it's a barrier because we can't afford it. There are so many free classes right now. So lots of opportunities for us to be able to move our bodies and just stay healthy.
Well, Connie, my intent with this is to always promote entrepreneurism and commercial opportunity, commercial work. So please feel free to make sure you tell people how to reach you,
okay,
when you're available, your contact, build your brand. This is about celebrating the energy and the value that your business brings to our community. I always say to people that our health is our business. And I say that because that's what I heard from my grandma.
Right?
Boy, mind your business, right?
Isn't that the truth?
And she would say both that your health is your business or our business.
That's right.
Obviously a double entendre, but we can take those warnings the right way. Our health is our business, and mind your business. And I say that health is a big business. My family was also involved in the church growing up, and I think my grandmother, grandfather was a pastor, would talk about, God's business is the biggest business on earth. But he talked about it as a business, right? And so the point I'm making is that we should look at what happens, the transactional apparatus that fuels and maintains relationships, and understand the business that goes on in becoming and being community, and that we should be mindful and intentional in making sure that we both bring benefit and gain benefit from the enterprise of being community, of being alive, of being families, of being community. That's what I think. So I wanted to also, in response to doctors Brown and Dr. Allison, sort of, let's see, I think I've lost my, oh, here I am, to talk about my own story, about risk factors. So I'm a 72-year-old Black man, right, with a recent heart failure diagnosis. And before that, a lifelong issue with obesity and hypertension. And along with that, fairly recent diagnoses around prostate cancer. I'm doing okay on all fronts right now. But I want to say this in a way to encourage listeners and viewers, Black men in particular, Black people who are older, to really pay attention. And one of the advices that I'm hearing from all of you right now, and you in particular, Connie, keep busy, keep moving. Got to keep moving, right? Don't sit and be sedentary. And you are inviting and instructing us to do all we can to make our bodies as resistant as possible. And doctors, you're saying also to be careful and to be intentional and to use the recommended strategies of social distancing, and also the strategy of using a cover to prevent other people from your situation, but also to help you telegraph that you are aware and attuned. So I want to say that just to bring the conversation into the real and the personal. And Dr. Melody, so I'm saying that how important is it for people like me to pay more attention, special attention, and what does that do towards the overall awareness about health and improvement and extending quality of life for our people?
That is something that really can't be overstated. As we heard from our last physician who spoke, in our community, we often do have so many of these comorbidities or, risk factors that put us in a position to have sometimes a little bit more challenge in dealing when we get infections such as COVID, but we do have the opportunity to make changes. And so you talk a lot about moving, and moving is so important. And it's important for the weight management that can come along with it and the other health factors that go along with it, but it's also really important for stress management. So for so many of us who are, sheltering in place, and those of us who aren't able to shelter in place, so those of us who are essential workers who keep our society moving and going, the people who are making sure that our streets are clean and that we are in safe areas, particularly in the hospital, making sure that everything is sanitized. There are plenty of people who are not able to stay home and shelter in place. So whether you are someone who is staying home and doing your part to fight this epidemic by staying home, or if you're someone who needs to go out and you're doing your part to fight this epidemic by going out, in either case, finding ways to stay physically active and physically fit may help improve your weight, as I mentioned, could improve your blood pressure. We know that increased weight and obesity is a risk factor for things like diabetes. So managing all of that through exercise are ways that we can keep ourselves healthy during this time, but often beyond. The other piece that I mentioned is the stress management factor. And so moving, staying fit, keeping mental fitness. So whether it is that you have your own meditation practice or there are other things that you do along those lines, people are talking a lot more about mindfulness these days. All of these things are things that can really help reduce that stress level for this stressful situation that we're all in.
Connie, you were about to say something, I think.
I just want to say, preach, Dr. Brown, preach. Oh my gosh. It's so true. I tell all of my clients, it's awesome that you are trying to get your body into physical condition. Right now, we have to worry about this stress that is killing us. Seriously, it is killing us. And the way to alleviate that is to move your body. Oprah and Deepak have this free meditation that they are offering, and it's fantastic. And if you're not a big fan, there are other things that are free, but just to meditate, to just still your mind, quiet your body for 5-10 minutes a day makes a huge difference in your health. And so, yes, stress is a huge fact. We have to start taking care of that.
And I think that sometimes when we think about, how do we exercise and how do we be healthy and how do we eat right, it just feels so overwhelming, right? Because you feel like I have to do it all right now at this moment. But the fact of the matter is that any step that you take in a forward direction is progress.
Yes,
so no matter how little or how big it is, if you keep taking one step and another step forward, you are making progress, and you should congratulate yourself for that and keep on moving.
Great. Dr.
Can I just
Brotherson.
interject?
Go ahead, please.
Thank you, Al. One of the things I just agree, as I am agreeing as a person who works in the court systems, it's obviously stressful. And there's also things like I know that doctors and other people see as well. We see some of the worst. And so there's something called compassion fatigue, or it's kind of like when you see all the trauma that you can absorb some of that trauma as well. So I think it's really important that no matter what profession that you're in, I'm just agreeing with what Connie and Dr. Melanie Brown have been saying. So when I've been sheltered at home to the extent possible, because we've been trading off when we go into court, I've been walking. And even when and just walking a little bit, even if I only have 30 minutes to walk or 20 minutes to walk. And then I found out, and I have to plug this too, because one of the things that the Links Incorporated likes also is just saying we need to walk for our healthy living. And so I found out that if you have a simple iPhone or most of those Androids, you don't even have to have a fancy iWatch or whatever, but as long as you're walking with your phone, it tells you how many steps you get. So then, I'm trying for 10,000 steps a day. Sometimes maybe I get like 6 or 7, but at least I'm trying to monitor my steps. And if I've been sitting in front of a screen doing Zoom hearings back to back all day, or meetings or whatever we've been doing, it's like we got to take a little break and get up and go walk. And I think that helps to relieve that stress and makes you feel better.
I'm the kind of guy that works at a computer here till 2 or 3 in the morning, and then I get up at 5 and start again. But I told my daughter and my wife today that after today, I'm going to shut my business day down at about 2 o'clock every afternoon. That after I do this broadcast, turning off the computer and turning off the phone, and she and I are going to go for a walk. Nice. And that I'm going to try to make that, I'm sort of saying this publicly to make myself do it, right?
Yes.
Making a public commitment.
Yes.
That my intent is that my business day, and this has never happened in my life, will end every day at around 2 o'clock. And from 2 o'clock until I go to bed, I'll just be hopefully devoted to listening to my wife and doing gardening in the backyard and taking walks and trying to reduce stress and be more healthy, be more mindful. Because you know what, I want to live a long time, and I know that I have to do things differently to assist and to move towards assuring that can happen. Dr. Brotherson, you were going to say something.
Yes, I had a little computer malfunction, so I'm trying to work this here. I wanted to address what Melanie said about stress, because two things. The first one is that one of the things that we worry about with this shelter in place, and this is why it's so important to maintain healthy habits is because we are not designed to shelter for the length of time. This is why people are you get to the point where you cannot stay indoors anymore. And I think that's what we were seeing. So part of what we worry about is that we'd have like a third stage where first we get the acute problem. Then we're going to I want to talk a little bit about the exacerbation of the chronic health problem. But then the third stage is kind of where our mental health kind of goes a little short, because this is really unusual for all of the things that COVID is causing, including the issue with not being able to work, cooped up inside. We're going to put on the pandemic 13. That's the 13 pounds we're going to all gain from eating too much while we're sheltered in place. Mm-hmm. But the thing that we worry about too is what this the end result of this, that in terms of our mental health, mm-hmm. we are going to have to deal with that. Another unintentional consequence of the COVID outbreak for people who have chronic medical conditions, because we shut everything down to manage COVID, we have let a lot of people out in the cold who need to have their diabetes managed, their blood pressure checked, and so on. So the big worry that we have is that we have this whole group of people, and mainly people of color, we know that are most at risk for all of these issues mm-hmm. that we have out there, that now after we see this first wave of COVID, we're going to get this whole exacerbation of your diabetes not under control and so on. That's worrisome from the perspective of how we look at underserved communities. So it's the mental health thing down the road, but it's really thinking about how we get back on track really quickly, even though we're worried about surges and all of that, to make sure we're providing care for folks, many of us who have, some sort of problem. So I think that's, if I thought of priorities for, in my role, in thinking about the impact of this on people that we take care of, it's really about thinking about this preventive care issue and management of chronic diseases, because that's going to be the other thing. In terms of our pediatrics is vaccines. When kids can't get vaccines, we see resurgences of other diseases. So the other day I shuddered when I heard that there was another measles outbreak, and I went, here is an unintended consequence. So there's those things that we have to think about as it pertains to our health and on chronic disease.
I'm Al McFarlane. This is a special Friday edition of Conversations with Al McFarlane. Thanks to Dr. Ainel Rosario, who's co-creating this series. We're calling this series Serving the Underserved. And Dr. Rosario has marshaled the talent, leadership, the genius of her colleagues, members of the National Medical Association, and colleagues in community to bring a series of conversations about health, about medicine, about community, and our responsibility to each other, particularly in the time of COVID-19. So I'm going to ask my panelists here to just jump in. This is a conversation, and it's a great conversation. I really appreciate it. Dr. Brotherson, though, do you have any numbers, and if you don't, that's fine, on the fact that Hennepin County is like the highest impact, according to what I've seen on the state guidelines for the COVID presence?
So I looked that up before we came on. I'm going to cheat here and look at my cheat sheet.
Sure.
So in Hennepin County, we do have probably the highest incidence of cases. I checked the 11 o'clock report today, and we have about 4,300 cases in Hennepin County, and we have 1,261 in Ramsey County, and we know that's where we have a high percentage of African Americans that live here. Altogether, we've had 2,650 people of African American heritage who've had COVID and 36 deaths. That, I guess, doesn't look like there's some pockets in the country where we've seen much higher death rates. One of the things that, I'm not sure about is whether or not the number is how much testing we're really getting in the African American community. So that's something that might be confounding. at Hennepin, I think it was the end of April, I ran a report looking at our positive cases just to see what the distribution was by zip code. Because there's an association with poverty and zip codes and health outcomes. It was just a first pass of it, but it was exactly what I thought. We had 400 up to that time positive cases. We have many more now. We have at least 1,002 now, just within our hospital system. And I wasn't surprised to find that because we're a safety net and because of our patient population, the majority of patients who were positive were African American. I'm forgetting what the numbers were. Second highest were are people of Hispanic origin, and the third were Native Americans, which is exactly what we thought. And the distribution by zip code was follow that same pattern. 55404, which is where our hospital is, had the highest number. I didn't think to pull that data for you today, but that would have been an interesting point. So when you look overall, the numbers don't look bad, which is what the Wilder report showed us a couple of years ago. But if you went by zip code, where we have pockets of poverty and unemployment and health encampments and homeless shelters, that's when you start seeing the numbers really tell the story. So that information is important for us to do. And one of the things that I think we should advocate for is not only so data by race and ethnicity, which is important, but not to admire the data, because we could collect data until we're blue in the face.
Right.
What do we do with it? We want it to be focused, and so that we know where those pockets are, so we could direct our efforts in areas where people most need help. And I think if we could start collecting data in that way, it will help us, our community organizations, think, I might want to look at a food shelter in that area and support them. Or this is a place where people have a lot of COVID. What are their support systems? How can we do that? So that would be one of the things that we would encourage.
Judge Branford, I bet you that you could overlay the zip code analysis over your caseload in the district court. And this is really a reflection of a system-wide set of deficiencies or disparities. They're showing up here. And I think one of the lessons we're going to be learning from COVID-19 is it's going to reveal where we have these gaps and how persistent and how pervasive and longstanding these gaps have been, and how they turn up in social places like crime, family neglect, family abuse, family breakup, in employment and mental health, all kinds of ways these things show up, and they wind their way through processes and systems, including the court system. But this kind of is a wake-up call beyond just COVID-19. Do you think that's true, Judge Branford?
Thank you, Al. I do think that's true. We've already previously done analyses, as Dr. Brotherson said, to indicate, and it's no secret, that where there are pockets of poverty and people are unemployed, that there's also greater crime. And so we see them coming into court more frequently. Another point that I'm concerned about is that during this time of shelter in place, where there's no schools in session, distance learning, and where people haven't been going to the doctors for their just routine checkups, those are the reporters, the mandated reporters that must report when they see incidents of abuse and neglect. So therefore, during the last 9 weeks or so of shelter in place, our number of child protection types of emergency cases has dramatically decreased. That being said, we do not believe that incidents of abuse or neglect have decreased. It's just that the reporting to them, the reporting to the court, to the authorities, social workers having to get out to the homes where you're sheltering in place, all that kind of has resulted in a decrease in the number of cases coming into court, which was kind of intentional in that we were we were just doing the most emergency cases.
Mhm.
The most, like if a child tested positive for heroin and cocaine at birth, that would be the type of thing that we would get usually from Hennepin County or something. And those would be the emergency types of cases that we would see. We are also concerned that now we're going to see an influx of more cases coming in. First of all, because there was a backlog and we postponed all of our out of custody cases and as much as we could. And secondly, because once people come out of sheltered in place, we anticipate that we'll see more cases coming in. But you're right that this really, unfortunately, is a reflection of the disparities and the inequities that have happened within our society. And, we've been working within the courts to try to reduce those, but the disparities are still there. I do want to note that about over 10 years ago in juvenile court specifically, we were working to try to reduce the number of young people in detention. And we did that through, I was the presiding judge of the time, we did it through the Juvenile Detention Initiative, JDAI, which is through Annie Casey Foundation, Ramsey County, Dakota County. We dramatically decreased the number of young people in detention, which was good, meaning that we didn't have people in there for not meeting with their probation officer, for testing positive for marijuana, or for little things. So now, hopefully, instead of when I was there in the past, in the bad old days, we used to have 100 and some young people in a detention center that was meant for 83. And right now we get that daily population, and we're, when I checked yesterday, we were at 30. So we're now closer between 27, maybe sometimes we get up to 40, but we're down low enough so that we can at least, hopefully the young people that are there because there's truly a danger to the public. They're alleged to have shot somebody, hurt somebody, stab somebody. I mean, something that's truly dangerous, and or they fail to return to court. So with those in place, we still have to work with the medical professionals to make sure that if there's any incidents of COVID, or if there's, which there have not been yet, but anyway, when people come in and there may have been exposed, that they keep them isolated, that they wear masks when they come into court, that we're trying to do all those things to keep everyone safe. But because, at least for the detention center, it was built for 83 people, we have 30, there's enough space to physically isolate people. So
what has
we're
been
working on things like that.
What has been, maybe you don't know this, or maybe you do, the strategy for keeping children or inmates in county jail safe? I thought that I had read that there were incidences of people having COVID-19 in both the county jail, and one of the responses was to try to separate out and to get people out that didn't need to be there, that could be managed better at home, and to not be exposed. And I'm wondering, even in the entire criminal justice system, Judge Bransford, what's happening at the prisons? Is there any correspondence about the prison populations? How do they keep prisoners safe?
Well, this is what I can say. Just because of sheltered in place, and because of the need to not transfer the disease to other people. For instance, if we have, my understanding is that the Department of Corrections is not moving any inmates.
Mhm.
So if they're in one spot, for instance, we usually need to have them come to court. For instance, I could have a parent who someone is trying to, the county is trying to terminate the parents' parental rights, or they need to come to court for something else. They're not coming to court.
Mhm.
They're not transferring the bodies to court. So instead, we're using technology. We're having a Zoom hearing. So that's one way that they're trying to keep people separate and not transfer people around. Another way is, it's my understanding that they're asking people questions. I don't really know enough about if the DOC is testing everybody or what they're doing with the level of testing. If they are testing to see if anyone has any symptoms or anything, or if they have any reason to believe that they are. And I believe as new people come into both the county jail and the juvenile detention centers, that they isolate them for the first 48 hours until they gather more information. And as you said, we're trying within our power to get as many people out of prison and jails as possible. So if people can be released in electronic home monitoring, we're doing that rather than having them locked up. If they're out at the county workhouse and there's only like a month left in their time or whatever, we're just letting them go home on electronic home monitoring rather than stay out there. And similarly speaking, I've only read, because I'm not in charge of the DOC, obviously, but the Department of Corrections, they have also been, if people are in their last 90 days, I believe, of their time, they're allowing them just to go home, or maybe go home on electronic home monitoring or some type of monitoring, but rather than stay there. I don't know the particulars about what they're doing to address when there are outbreaks within the prisons, but I presume that they're trying to separate, isolate, and treat.
Dr. Brotherson, you mentioned that the county has several places for people to get tested. And one of the places around the corner from where I live in North Minneapolis, and our jewel for healthcare is the North Point Health and Wellness Clinic. And they have been doing actual COVID testing, I think, on a daily basis, several days a week. And it's a wonderful thing from the passerby's point of view, because it's mobile. You drive in to the parking lot at the Thor building, it's called. It's got a different name for it now, but it's the building on the corner of Plymouth and Penn where North Point has offices. And they've organized it so that people can, if they register in advance or make appointments, drive up, be greeted by the professionals on their medical team, and then escorted to a place where they are given the test. The people who are greeting them are fully equipped with PPE, and they can get tested. And I understand people are using that service. What other places are there that people can access to get a test if they feel they need one? Unmute your mic for me. Unmute your mic.
Yeah. So the Hennepin healthcare system has 4 testing sites. Mm-hmm. There is one site, we don't have any drive-up testing areas, but we do have our clinics. One testing site is downtown at the main hospital. Mm-hmm. We have one at the Brooklyn Park clinic, which is on Zane Avenue. We have another testing site at the Whittier Clinic, which is at 29th and Blaisdell. Mm-hmm. And then we have a third site in Richfield, which is on West 66th Street in Richfield. Those also require a call beforehand, and so that we know you're coming. Since we've had we started viral screening clinic. The first one was put up on March the 16th. And the other 3 were started on April the 27th. And up to, I think, Monday, we had tested 3,500 people. The reason for putting the clinics out, the testing sites out in the community, is because the reason of ensuring easy availability of testing to our patients who lived out in those communities. And we're seeing the numbers increasing daily. So we are working on determining how we could expand that, whether it would involve adding a drive-up center, testing sites. That's still in the works. But part of our goal is to make testing easily available for residents of Hennepin County.
Demetrius Pendleton was on the call for a bit. Maybe he couldn't stay on, but he's one of the members of community who's been responding by creating and providing, I think, free of charge face masks for different organizations. And we want to thank him for that insight and that initiative, that compassion. And it's one more example of what we can do for ourselves in community. And if he comes back on, I'll bring him on. But we're moving towards the end of this program. It's been a great program. I warned Dr. Brown before the show that I often ask my guests to be personal, because I'm curious about how people come to the person they are today, what their path has been. My curiosity seeks to show that where we are is on a point of lineage from our parents and our grandparents and the teachers and all the people that have influenced our lives that brought us to the passion that we have. So I'm going to ask each of you in the last round to give a 2-minute story about what makes you passionate about this conversation, what you bring in terms of both training and family direction, cultural direction to the attention you're giving to the issue we're addressing today. And I'm going to start with Melanie Brown. So I kind of warned her beforehand. So Dr. Brown.
I hear so many people who tell stories of how they've always wanted to be a doctor and they've known since they were age 5. I was actually an engineer first, so I can't say that I had that same insight, but I will say this. When I think about what makes me passionate about medicine, I am honored with the idea that people will entrust me with the care of their children. I really do believe that children are the future of our world, of our society. And the idea of being able to partner in order to have, a healthier future is really what excites and motivates me. When I think about my story, and I know we don't have much time, I can talk a lot, so I'll let someone else go.
Well, 2 more things.
Yeah.
You're now at the, is it the American Association, or you're the chair, the new chair?
Yes,
Tell us about that.
yes. So I'm the chair-elect for the section of integrative medicine for the American Academy of Pediatrics. And so American Academy of Pediatrics, is a national organization that is really focused on the health and welfare of our children, supporting pediatricians who are in the honorable position of being able to care for them. But when we talk about integrative medicine, we hear a lot about, I talked a little bit about mindfulness, but it's really looking at people's strengths and looking at them from a standpoint of wellness, not looking only at disease, but looking at what are the things that we can do within our lives to help us prepare for disease, or that can help prepare us so that we maybe aren't at risk for some of these diseases that can be caused by lifestyle choices. And so in integrative medicine, we look at taking a natural and holistic approach, looking at sort of all aspects of lifestyle, partnering with what we think of as traditional medical systems to see if there are ways to help people be healthier. And so as the chair-elect of that section, one of the things that we're working to do is to really drive that conversation within the country. What sorts of things can we really do to look at the strengths of the children in our community and everywhere, and help them grow into the best adults and healthiest adults that they can be.
Wonderful. Well, thank you. Dr. Brotherson, I'll go to you next, and then to Connie, and then to Judge Bransford to finalize the program.
Sure. Thank you. So my journey to medicine, I grew up in the Caribbean. I was a teacher, junior high school for a long time. I always wanted to be a physician, but in the Caribbean, there's one medical school that supplies the whole Caribbean. So it wasn't until I moved to the United States that I had the opportunity to pursue my dream. My dad was a public health, ran the public health service of our country. Trinidad is a little island. I don't know, even a little fraction of the size of Minnesota. And he had this dream that I would do this. My passion for medicine led me to be, the word doctor means teacher. And for years, I was the residency program director for the family medicine residency program here at Hennepin because of my love for teaching. And I take that same thing to my patients, because an informed patient is an empowered patient. I look at the population of patients that I get an opportunity to work with, and I have a passion for women's health and want to, particularly Black women's health, and I'm very committed to their mental and physical health, and want to be able to stand in that gap to support them through to good health. The thing for me with serving the underserved is just how for so long we have, we talk about structural racism. I think my passion now is to stop kicking the bucket down the road and shrugging my shoulders and say, well, that's just how it is. I think we really here we are at the door of another disease, and we're, on the front lines of being the most affected. And I think we have to really leverage our voices and use our strength to advocate for a destruction of structural racism, to create spaces that makes healthcare even and allows the poorest of us to have the same healthcare that even the richest of us has, because healthcare is not a privilege, it is a right. And for too many of us, that has not happened. So my ongoing passion for my underserved patients and this population is for us to do that. Melanie said to me a couple of weeks ago, it's such a big task to even take that on. But if we started and we took one bite of this elephant and we do it now, I think that we could. I want us to commit to that and move to doing what we can to improve health, so that when another round, a new disease comes, we will not be on the front lines to be the most seriously affected by it.
And what's your home country?
Oh, I grew up in the lovely island of Trinidad and Tobago. Trinidad was my home country.
Well, it's a wonderful accent. Thank you so much for this testimony. Connie Sheehan, you're an entrepreneur, but you've got a storied corporate career as well.
Well, actually, I want to take a little different, just a different slant at it. What I am so passionate about our subject today is I'm the mother of 5 sons, and my youngest was studying abroad, most recently in Istanbul, and got home and got very ill. And it just so happened that he was not insured, and that's another long story, but he wasn't insured, and we needed to get him tested. And I have to say, as an educated person, and certainly not living in a poverty level right now, it took my sister, who lives in Illinois, to call me and just hound me because they were telling me, you can't get him tested. Sorry, he can't be tested. And she pushed me to fight for him to get tested and to advocate for him. And I have to tell you, I get it. I understand why people don't do it. I was scared. I was nervous. I thought the doctor, we took him to urgent care, she must know. And I was so grateful that my sister pushed me and said, be an advocate, fight for your son. He is not well, and he was sick for 10 days. So anyway, got him tested. It turns out he has mono, and he's doing much better. But I look at our folks and say, I get it. I understand. And somehow or another, we got to get into the community. And like my sister was the advocate for me, we have to be advocates for folks and say, get tested. If there's something wrong, get to the doctor. So, so this is huge for me, just to have my son, who is well now, thank you, God. But it was very scary. It was very scary. So I want people to get the message to take care of your bodies. And then if you are ill, go and get tested.
Thank you so much, Judge Branford, Tanya Branford. Thank you. Let me have you close the program out, just reflections, and talk about your passion, your path as well.
Well, thank you. Unlike my linked sister, Melanie, I didn't have a lot of other careers before I became what I'm doing now. So really, when I was 14, I knew that I either wanted to be a lawyer or a journalist. And I was one of those young people doing the urban journalism workshop, trying to see if that was it. Some of my friends who are now journalists said that I chose the right path to go into law. But the real reason was because of my passion for really serving the underserved and for and doing that and figuring out how we can make the courts work better so they're really more fair towards everyone. And so I think there's a lot of pride in that, as far as I've worked in areas where we've referred people to treatment, where we've tried to get to the root of the problem. We've had people that are chemically dependent, that are mentally ill, and we have treatment courts and juvenile courts that surround that. We educate parents and help them get to the point where they can be good parents and reunify families. So there's a lot of hope and optimism there. And also the idea that somebody in there that really reflects the population in which we serve, that understands the fear that can happen if you have a Black son who gets stopped by the police and what can happen, and that everything that they say is not always true. And so you have to be able to believe it, to look at everything with a skeptical eye. So it's my privilege to be a part of this. And I would say that as far as my community organization with the Links Incorporated, we are strongly in favor of supporting public health and education about public health and making sure that we all stay healthy and safe.
Listen, this has been a great hour. I want to thank each and every one of you. Thanks to those who are listening, watching on Facebook, watching on YouTube. If you like this kind of conversation, like it and share it. Subscribe on YouTube and tell people about it. We'll be here again next Friday for another conversation on the theme, Serving the Underserved. Thanks to Dr. Ainel Rosario, the mastermind of this series of conversations, and her colleagues at National Medical Association and the other guests as well. I'm Al McFarlane. We'll see you next week. Thanks, you guys. We'll see you later.
Bye. Thank you.
Thank you so much. Thank you, Al.
Bye-bye.